Hello, I'm Captain Dr. Dave, and I'd like to present you with my Cruising the Great Lakes. This is basically an inland cruising with pets presentation. Um, Hopefully you'll find some useful information here if you tend to cruise with your dog or cat aboard in the Great Lakes or in the inland waters. And one of the first things that I like to mention is that I do have some material that's available. Nothing is really required for you to cruise, as you know, and nothing is really required for this course, but I do want to make available the fact that I do have my book, Where There Is No Pet Doctor, which was originally released as Wilderness Veterinary Companion for Cruisers. It's a book that has a lot of useful information in it, but frankly, if you're cruising in an inland situation, you really don't need this kind of offshore wilderness information because there's generally a veterinarian available, usually within a matter of a couple of hours or at least within a matter of a day's sail from wherever you happen to be if you're cruising inland. So the other thing and if you do decide to get it, you can pick it up at my website, CaptainDrDave.com. Check out the uh, videos that I have available there. Check out the blog. There's a lot of useful information there. Um, you can use the discount code that I have listed here to get the $9 discount on the book. And let's see, we also have veterinary care for your dog, Where There Is No Pet Doctor, and the same for your cat, which are videos that basically illustrate a lot of the concepts that are demonstrated in the book, that I talk about in the book. So let's see here. And then I also have Pets on Board, which is adapting your pet to travel by boat or RV. For those of you who are thinking about cruising with a pet and wonder if you can do it, this kind of tells you how to make the transition. Again, you can get this book for a 20% discount using the discount code that I have listed here. These books are available through my website, which takes you to my publisher, CreateSpace.com, which is a branch of Amazon. So you can use all of your ordering information that you normally use for Amazon on this website. Or you can also, if it's more convenient for you, you can get them through Amazon.com. However, I get a better percentage of the action if you order it through my website. So if you're going to go cruising with your cat or dog, most people aren't going to have any problem here. Probably most of you already take your dog and cat out for a day sail here and there with you. If you have a tendency to want to take your pet aboard, most of you are probably already doing it. And if you can successfully take your cat or dog out for a day sail, then you essentially are good to go for cruising, because after all, a cruise is nothing more than a series of day sails. It's really not much different out there than it is at home. You need to be prepared for any urgencies that might come up. You can't prepare for everything, and really there's no need to when you are in an inland cruising situation. You really don't need to be prepared for much at all. Think about where you're going. Take along any important stuff, daily medications that you need to take, that sort of thing. And think about how to find the nearest veterinarian should the need arise. And if you're going to put in at various places along the way, you may want to check that out in advance and find out where veterinary care is available, how close it is at any of your intended stops that you intend to make. This is a picture of our boat Fidelis down in the Dominican Republic. When I wrote my book, we were holed up in the Dominican Republic on our way to the Caribbean, and we holed up there for 8 months for hurricane season back in 2005. That's when I wrote the book. We had an incident in the harbor where one of the local dogs picked up, there's a small Schipperke dog that the owners were walking ashore, and the dog picked up a toad, and shortly after the dog picked up the toad, the dog died, and the owners were shocked and dismayed, and the cruisers in the harbor wondered if there were anything else that they needed to know. So they asked me to do a seminar, and I put together a handout that turned into 10 pages for that seminar. And the book basically grew out of that handout. So that's where all of this came from. And most of the information in the book is intended for people who are going to be in a offshore, long-distance cruising situation, not necessarily for inshore work. This is a picture of us in Baltimore Harbor on our way south when we thought we had gotten away from Michigan's cold, wintry weather. We spent 3 years in Baltimore Harbor, and 2 of those winters looked like this. Actually, we spent 4 years there. Two of them looked like this. The first one was a very balmy, pleasant winter, and we thought, wow, if this is what it's like just coming this way south, maybe that's as far as we need to go. Well, it turned out that the next winter proved us dearly wrong, and we were living aboard through this entire 4 year period. Annie was dockmaster at Harborview Marina in Baltimore's Inner Harbor, while I worked at a nearby veterinary hospital. So this was Fidelis sitting, and it's not we're not sitting in ice here. We're sitting in slush, basically floating slush. So what we're going to cover here, suggested medical supplies that you may want to carry, and again, don't sweat it, okay? It's not a big deal. If you don't carry them, it's not anything to be overly concerned about. I'm going to try and help you avoid some of those things that might pop up unexpectedly that may save you a trip to the veterinarian. We're going to talk a little bit about local and regional dangers that you should be aware of. That is a significant issue because in all likelihood you're going to probably take your pet ashore, particularly if you have a dog. Take your dog ashore for walks, that sort of thing. We're going to talk a little bit about common minor health problems, a little bit about pet safety, and a little bit about some pet behavioral issues. And for the most part here, will discuss only dogs and cats. If you have questions about anything else like ferrets, that sort of thing, there's no, again, taking a ferret, you're not talking about international ports of entry and all that sort of thing here. So if you've got a ferret and want to take it along, I don't think you're going to run into any issues anywhere. It's going to stay aboard. You're probably not going to take it ashore and walk it. So I don't think anybody's going to be object particularly to having a ferret aboard, or even birds for that matter. My general recommendation with any animal that you take with you, bird, ferret, whatever, dog, cat, whatever it might be, is that you have it microchipped and register that microchip number so that you can prove that is the one thing that you can do for your pet in the event that somebody questions whether or not it might be yours, whether or not it might be smuggled into the country, whatever the case may be. If you have a chip on that pet, it proves that that pet is yours and that you brought it with you. So think about that. That's an important issue. I always tell people whether they're cruising internationally or locally. The minimum recommendations that I suggest you take with you if you're going to be gone for a prolonged period of time, take heartworm preventative. I generally encourage people to use it for cats and dogs. The problem is it's not a common problem in cats. It's an abnormal disease in cats, whereas in dogs they are a normal host. Cats are a abnormal host, so it's not a common problem in cats. But the downside of having heartworm in cats is that it's very, very difficult to detect, and it's impossible to treat. We have no treatment for it in cats, and cats frequently will die unexpectedly when they have heartworm. So it's a good idea to, if you have a cat, that it be on heartworm preventative. But again, no need to change your habits here because you're going cruising. That's just a general purpose recommendation. And I saw, when I used to practice for 20 years up in Michigan, I used to actually see a lot more heartworm up there than I see down here in Florida where I live now. You're going to want to take flea and tick control products, and that's important basically because you don't want to get fleas or ticks aboard your boat, and that's an important preventative issue from your own health standpoint. Nobody wants to be living with fleas and ticks. And in addition to that, you're going to want to take any specialty medications or any medications that your pet uses frequently. This includes things like anti-inflammatories, Deramax, Rimadyl, Metacam, those kind of products. For arthritis, inflammatory conditions, any allergy medications that your pet uses, antihistamines, corticosteroids, whatever that may be. Take long enough that you don't have to worry about running out while you're gone. Most of the time, when I used to live on the Great Lakes, our cruise a long cruise would be 3 weeks. Most of the time it was weekends we went. So for those kinds of situations, it's easy to plan ahead and take along adequate medication. Anticonvulsant medication or insulin, I generally recommend if you're doing long-term cruising that an epileptic or a diabetic should not go beyond 12 hours from good veterinary care. If you're cruising the Great Lakes or the inland waterways, most of the time you can do some pretty extensive cruising and still not worry about being more than a day away from good veterinary care. A series of convulsions or seizures could be fatal in a situation if you have an epileptic that is not well controlled with medication. So if you have that sort of situation, you may want to think twice about going cruising with a pet. Same thing with diabetics. If you have one that's very difficult to control and requires frequent visits to the veterinarian in order to get things under control, it may not be a good choice to take along with you on a long cruise. Motion sickness medications, most of the time you're not going to need them. Most pets don't need them. If there's vitamins or anything else that you want to take, feel free. But again, it's the key things to take are the medications that are prescribed medications that your pet needs to have on a daily basis so that you don't interrupt that regimen. And beyond the simple, I always tell people if you want to take along some amoxicillin, a 7-day supply for each pet, it's pretty cheap to take aboard with you. You don't need anything fancier than that. For those people who are going, offshore cruising and so forth, I a lot of times will give a backup recommendation for something a little more aggressive than that. But the more aggressive you get, the more expensive it gets. And frankly, you're looking at medication here that you intend to not use, so you're intending to essentially throw it away. So why waste your money on the more exotic antibiotics? Amoxicillin will cover just about anything and do it for a reasonable price. And if necessary, if you carry antibiotics aboard for your pet can share your own antibiotics if you have a reference source to give you that information. And the reference source that I recommend is my book up there at the top right, Where There Is No Pet Doctor. It has a complete drug formulary in the back for that gives you information on proper dosages for your pet under of any common medications that you may have aboard that might be indicated for use on your pet. That's one advantage to it. The book used to be about $40. I recently lowered the price to somewhere down around $20, I think, and so it is. It's within reach as far as cost. It's again, you don't really need it. The other book down there, Pets on Board, is my book on how to get your pet to adjust to traveling aboard your boat. It's a worthwhile little read. I used to get a lot of questions when I did seminars at boat shows from people. I got tired of answering the same questions all the time. How do you get your dog to go to the bathroom aboard the boat? If you don't want to take him ashore, how do you get your pet conditioned to going aboard your boat and get him over the fear, those kinds of things. There's a lot of answers in there, and it starts out with getting your pet out the door of your apartment or house and into your car, getting him adjusted to riding in your car, and then taking him to the boat and so forth. It's all incremental stuff. The Dog Owner's Home Veterinary Handbook is probably the most popular handbook out there. It's changed a little bit since this picture. It's still out there by a different author, and it is got a zillion diseases, got a lot of diseases in it that I've never seen before. I don't know whether it is of that much value to somebody who's a layperson as far as being able to make a diagnosis. My book tends to deal with things that I feel look like they are probably might look simple to you, but in reality may be quite serious, to try and help you avoid blowing something off that you think is minor that might be major. And it's also aimed at those things that are quite common that you're likely to run into that might be handleable without going and seeing the veterinarian. So I try to deal with things like that, give you things that you can maybe deal with and avoid a trip to the vet until you get back, save yourself a trip home. But again, it's designed more for the serious offshore cruiser rather than an inland cruiser. So some other things that you might want to take with you: topical antibiotic. A lot of times it's good to have that in your medicine cabinet or your first aid kit. Neosporin will do. You can use Neosporin on your dog or cat if you feel the need to. Generally, my recommendation with wounds is that you keep them clean. If you keep them clean, they're probably going to heal. Slathering a bunch of goop all over a wound usually will just result in the goop attracting dirt and making the wound worse. So if you just keep it clean and keep an eye on it, most of the time you don't have to worry. And again, they can share your antibiotic if you need to. If you want to take a tube of Otamax or Panalog or Dermalone or one of those products that you've gotten from your veterinarian, that works well. Works well on your pet. Works well on you. I don't recommend that you use it on you, although it is essentially the same as the human products. But since they're labeled for veterinary use only, I can't legally tell you to use them on yourself. Other items that you can take along, some aspirin. For pain, fever, inflammation, it is usually safe to give. Again, my recommendation when you're doing inland cruising, take your pet to the, if you think your pet needs some medication, take it to a veterinarian and find out and get what you really need. Do not ever give products such as Aleve. Aleve can be deadly and can be a real problem in a dog. It's deadly in a cat. Tylenol is deadly in a cat. Advil is dangerous in cats and dogs from the point of view of we never know the reason that it never got approved for use in veterinary medicine is because it's extremely unpredictable. In some animals it works quite well at reasonably low doses. In some animals it requires high doses. The metabolism of the drug is unpredictable, so it's generally recommended that we not use ibuprofen in cats and dogs. Aleve, keep in mind, is potentially deadly. Tylenol is deadly in cats. So, if your pet is already taking any kind of anti-inflammatory such as Duramax or Rimadyl or anything like that, do not mix any other kind of anti-inflammatory with it. Do not mix, do not give Rimadyl or Duramax to a pet who's taking steroids or any other kind of anti-inflammatory. Anti-inflammatory drugs don't mix well. And again, the safe dosage in dogs of aspirin. Aspirin's an extremely safe product used in a dog if there's no other drug in the picture. And it's also safe in cats if it's dosed at the proper dose and dosed only once every 3 days. What I usually tell people with a cat, if they really feel the need to give their cat aspirin, give it a quarter of a tablet and one time. And don't repeat it. If you feel the need to repeat it, something's wrong and it needs to be seen. So aspirin, if you want to take it along, if you feel that it's absolutely essential, but my recommendation is see your veterinarian or see a veterinarian. Eye irrigation solution is always safe to use. If your pet gets something in its eye, this is one of those little emergencies that sometimes you can solve. Your pet got something in its eye, it's got a runny eye. You can see some crud draining out of the eye and it looks kind of granular or whatever. Maybe you got some dust in the eye. Take a bottle of eye irrigating solution with you, such as Dacryose, which Dacryose, Dacryose is the brand name. There's a zillion different generic versions of it. It's basically a buffered saline solution that's safe to squirt in the eye. You hold the eye open, tip the animal's head up, hold the eye open, and squirt down along the inside of the lids and try and flush out whatever is in there. A lot of times that's all it takes to eliminate a draining eye. Swimmer's ear solution. If you've got a pet that tends to swim, this is not for animals that have ear infections and ear problems. I repeat, this is not for ear infections and ear problems. This is as a preventative for pets that like to swim. If you've got a dog that likes to swim, there's much more likely to get an infection in his ear if you don't get the water out of his ear after he swims. So what you need to do is wipe those ears out, flush those ears out with some fresh water. Again, I have 3 levels of water in the ear. 1 is dry ear, that's good. 2 is dirty water in the ear, and 3 is if you flush the dirty water out, you replace it with clean water, and then you can dry the ear with clean water in there. Dirty water in the ear is not good, and dirty water is what you're going to get just about any place where there's an anchorage. You're going to get less than good clean water. If your pet's swimming near a beach, that sort of thing, the water is not as clean as it should be. So when you're all done, flush that ear out, take the hose and dribble a little water into the ears and flush that ear out with some fresh clean water. Then wipe the ear out thoroughly with a towel. After you're all done, put a little swimmer's ear solution, and what I recommend people use is not some of the veterinary stuff that's on the market, but use the stuff that's for humans. It's a combination of alcohol with glycerin. All it is alcohol serves as a drying agent, and the glycerin serves as a moisturizing agent that's left behind when the alcohol evaporates. You can make your own using 90% alcohol. This is not rubbing alcohol. This is not 70% alcohol. This is 90%. It might be labeled 95, 93, 91, 97. It's usually an odd number. 90 something percent alcohol. If you put a little of that in a bottle, on a squirt tip bottle, and fill it most of the way full, and then add a few drops of glycerin. I'm talking here about a 1 ounce bottle. Put a few drops of glycerin in and shake it up well. That makes an excellent drying solution for swimmer's ear. And what you do is after you've flushed that ear out with fresh water and dried it as thoroughly as you can with a towel, then you put 2 or 3 drops of this swimmer's ear solution into the ear, massage it in well, and wipe it out with a little cotton ball, and it should absorb any moisture that's in there and dry that ear out. Betadine solution. If you have some on hand, it's good for you, good for your pet. Okay, as far as if there's any kind of an open wound that you want to flush out, but plain old clean water works just as well under most circumstances. If if you're concerned about infection, you can get betadine in a variety of products. You can get a generic version of it called povidone iodine. Betadine comes in a variety of mixes, from anything from a mouthwash to a douche to an ointment. There's a betadine surgical scrub. What I'm talking here about is what's labeled as betadine solution, and has no soap in it, nothing else in it. And what you do is put a few drops in a little water. It makes a weak, non-stinging, what we call a tamed iodine solution, and it is good for rinsing out wounds and preventing infection for the most part, for helping to maintain a wound. And again, put enough in some fresh, clean water for a flush or a soak. You make it the color of strong tea. You do not want it to be so dark that it's opaque. Hydrogen peroxide is not a great antiseptic, although it's not a bad product. It's good for cleaning. The bubbling is just basically the hydrogen peroxide turning into water and oxygen. But it is a good wound cleaner for bubbling things out. And what I like peroxide for, it works well for cleaning blood. If you get blood on something that you want to get the blood out of, put a little hydrogen peroxide on it and let it soak for a little bit. And if your animal happens to eat something that is potentially toxic, it often works well as an emetic to induce vomiting. You put a teaspoon to a tablespoon down a 20-pound dog, wait 5-10 minutes, and a lot of times it will bring up anything that's in his stomach, or at least he'll bring up a substantial amount of what's in his stomach. Another product that I recommend is Quick Clot. Quick Clot is a clotting product to help if there's a major wound that's like a hemorrhaging wound that you're afraid the animal's going to bleed to death. This is not something you need to open up and slap onto something where we've got a little laceration going on. Quick Clot has a potential to be caustic to the tissues if you use it when it doesn't need to be used. You can go to quickclot.com to find it. It comes in packages. You can also get it through Cabela's on their online website. It's made for active hemorrhage. You basically open up the thing. It's a big gob of gauze impregnated with a chemical, and you basically push it against the spot where the blood's squirting from and hold it there for 10 minutes. And very often it will do an excellent job of stopping any kind of serious hemorrhagic arterial type bleeding. You do not have to buy the Pet Clot version. You can buy a packet of this Quick Clot and put it in your human kit, and if you happen to need it for your pet, it's available. Stuff's the same. Okay, finally, toenail trimmers. If your pet breaks a toenail while you're underway, you need to, you may feel the need to get to a veterinarian. If it's the type of pet that's not going to bite your face off, trimming that nail off, you can cut that nail off and cauterize it. You can cut that nail off and put a wrap on it. If you keep the nails trimmed before you go, preventatively is the best way to use toenail trimmers. Keep those nails trimmed down so they're not going to get caught between the boards on a dock when you're walking ashore. That's one of the more common injuries that we run into with dogs that are cruising, is getting a toenail caught in a dock and breaking off a toenail. So if you keep the nails trimmed, probably not going to have that problem. Magnifying glass and a pen light's always handy to have, and something you're usually going to have available on a boat. A thermometer might come in handy, but I don't think you need to get that involved. Again, we're inshore cruising here, coastal cruising, not something that we really need to do, be checking our pet's temperature on a regular basis. If you think your pet is sick enough to have that it needs its temperature taken, get to the vet. Simple solution. Super glue is good for minor cuts. You can use it if you've got a good, clean, very fresh, uncontaminated cut, and it's a real minor one. You can put a drop of super glue in it. It stings, I'll warn you that, but it can be done. I generally, again, if in doubt, get to your veterinarian and take your pet in. For a bleeding toenail, one of the quickest solutions I know of where you've got a toenail that you've trimmed too short and there's a bloody little spot on the end of it is take that bleeding toenail and rake it across a bar of soap. Very often that's all it takes. If the little bleb of soap falls off the end, scrape it across again. Usually that's all you need to stop a routine bleeding toenail. Okay, identification. This is probably the single most important thing that you can take away from this particular webinar, is that people need to know that your pet lives aboard a cruising boat. All right, there needs to be some indication on your pet that your pet is not a local pet that got lost. If you go cruise the North Channel up along the Canadian shoreline and you lose your pet ashore somehow through some fluke accident, your cat jumps ship and runs ashore to check things out, and now there's a stray cat in town. People don't know where it came from. All right, same thing could happen to your dog. Okay, we used to find when Annie was managing the marina in Baltimore, that was the most common issue we had with cats living on board, was that it wasn't because they wanted to get off the boat, it's because they wanted to check out everything else around the area, all these other boats. They wanted to check out the docks. So cats have a tendency to jump ship and go exploring. It's their nature. Okay, curiosity killed the cat, right? We had some very good friends down in the islands when we were cruising who were coming through the Bahamas and pulled into a marina for the night, and just for the night, and they got ready to go the next day, couldn't find their cat. They spent a week at that marina looking for their cat. And I know quite well exactly what happened, because it's happened at our marina in Baltimore when we were there, is that cat went aboard somebody else's boat who was also there for only the night and ended up someplace else, and unfortunately they never saw their cat again. So if you have proper identification, this sort of problem can be remedied, and it is the most tragic situation you can possibly have when you're underway. Normal people are not going to, who live in that town, cruisers come, cruisers go, they are not going to think about the fact that this pet might have come off a cruising boat, and if it did, what can they do about it if they can't get hold of you? So it's equally important for both cats and dogs. So what can you do? Number one, do what Annie and I do. Even though we're not living aboard anymore, we live in an RV now and we travel from place to place. The most important thing is to have something that won't come off the pet. A microchip is helpful, okay, if you happen to be lucky enough to have it found by somebody who's going to go through the trouble of taking it somewhere, having it scanned, going through the process of contacting the registry and trying to find out who it belongs to. That's a lot of work, a lot of effort, a lot of time. I'm amazed at how many people do that, but I'm certain I would not be amazed at how many times that does not happen. So don't count on a microchip. Out of sight, out of mind. That's my feeling about a microchip. People just aren't going to think about it. So you need something that's visible, that's going to remind somebody, gee, this pet might be lost. So an embroidered collar is where I start. And we don't put anything on Mucho is our cat. We don't put anything on his collar other than 2 cell phone numbers, my cell phone number and Annie's cell phone number. If you want to put a boat name somewhere on there, like on a hanging tag, this is Max. He lives aboard the sailing vessel Second Wind, okay, something along those lines, or he lives aboard the motor vessel, Real Fun, something like that. You can put a tag on there. That'll help. That'll let people know where he lives. But make sure there's a phone number, a cell phone number that can be reached. This is your pet's link to survival. Is the phone number that's available for somebody to call who finds him. So make sure you have something with a visible phone number. Then the other thing that I have begun to encourage people to do, Mooch wears what we call a Protect Pet digital ID tag. Can't get it anymore. I got it off Amazon a couple years ago, and I'm already on the second one because it's just a little plastic thing. But it is essentially a USB device that hangs from his collar. Just a little piece of plastic with a couple of metal strips on it that make contact when you stick it into a USB slot. And on that tag, I have all of the information on where we are right now. Not where we were a year or two ago, It's information. If we're traveling, it tells people we are traveling through the states of Kentucky, Tennessee, Alabama, Georgia, and Florida. Okay, we are going to be, you can reach us at this particular location. And in that, there's a whole message in there that says, if you will please get him to if you're not willing to keep him, please take him to a boarding facility and have them call these phone numbers, and we will be financially responsible for his care, and we will reimburse you for any expenses that you might encounter in getting him back to us. All of that information is in there. All they have to do is, everybody knows what a USB looks like. All they have to do is stick it into their computer and read the file. And they've got everything they want. They've got I've got vaccination certificates on that USB. I've got his rabies certificate. I've got his care and maintenance information. And I've got a plea to anybody that finds him to please get him back to us at any expense, and we will take care of it's very easy to do this when you have a USB drive attached to the collar. It's immediately accessible and changeable. If you feel like changing it right now, take it off, put it in your computer and change it. It's that quick and easy to do, and it's permanent. Okay, so these things are quite resistant to any kind of moisture and dirt and all that sort of thing. So this is one variation. That's the one that's my preference above all else, because you have such easy access to changing it and all of that. The medium to large dog version of it is a little aluminum capsule with a USB drive in it called Flexi PC Pet ID. I have one of those also, but it's too big for a cat or a small dog. It's a little bit dangly, but for a big dog, perfect solution. I mean, these things cost anywhere from $10 to $25 depending on what you're doing here. So there's nothing here that's outrageously expensive. And also now we have access to these QR tags, which are like those things that you read with your phone. You point your phone at it and it reads like a UPC symbol almost, but it looks like a square with a bunch of mumble jumble in the middle of it. You aim your phone at it and it connects you to a website. And if you buy a dino tag or a red dingo QR tag, which is a nice big metal or small metal, depending on what kind of animal you're putting it on, when you pay the price for the tag, you get free registration of the tag. And I do believe you get your own web URL for that tag along with it, that, as a subdomain, I'm sure, on their own URL. That will connect you to a that will connect whoever points their phone at it and reads it, will connect them to a location where you have hopefully recorded all of your information and kept it all up to date, and there's no charge over and above the cost of the tag for this. So, check into it more thoroughly, because I can't be sure, because I haven't used either one of these, but I have researched them. This is really important stuff, okay? Anybody with a smartphone, and boy, they're everywhere nowadays. And if you don't have a smartphone, you know somebody who's got one, so you can do it. If you're concerned about what this tag might say, you're gonna do it. And I suggest you read my blog article at CaptainDrDave.com. It's called Pet Tags for the 21st Century. It goes into a little more detail on these tags, but I would suggest that you should have some sort of electronic modern tag on your pet that will allow you instant communication with whoever might find your pet. And I have on here no 800 coverage outside the USA. If you take one of these things, a red dingo or a Dynatag, I don't think it's going to be an issue, because it goes to a website and not a phone number. So that probably is not an issue. And this is a picture of some of those. Up on the upper left, you can see the size. I put a quarter there, so you can see the size of the Flexi PC. That's the one that's for bigger dogs. And that's a 30-pound dog, 25-pound dog there that's wearing one. And he's able to wear it okay. If you've got a 6-pound pocket Chihuahua, probably that would be too big. And it's too big for most cats, I think. But you can see what Mooch has on in the picture there. He has his embroidered collar, which has his phone number on, or our phone numbers on it. And he has his Pet Protect digital ID tag, the one up there at the top in the middle. It is unavailable now through Amazon. I think there's been a problem with finding somebody to distribute it. The problem with the Pet Protect is it's made out of plastic. And So it has a tendency where the ring goes through it, and I had this happen once already. Where the ring goes through the plastic, there's a tendency for it to get broken, especially if you have a cat that does a lot of roughhousing. The Dynatag is down at the bottom in the middle, and you can buy these in a package of 3 for about $10, or no, it's more than that, probably $15 or $20 on Amazon. Go to my site. I have these things listed. You can click on it, and it'll take you right to the page on Amazon where you can order these things. But a 3-pack is like $20, and you can put one on 3 different pets. Doesn't have to be. Remember, the information takes you to a location on the web. So it's not pet specific information, it's you specific information that's going to be on that website so that they can contact you. You can even put it on your luggage, okay, and it'll still take you to the same site. There's a lot of purposes for these Dynatags. The one on the lower left is the red dingo QR tag, and it's not red because it's a red dingo. They come in a variety of patterns and a variety of colors and all that. They're quite decorative. The problem I have with those is they almost could be mistaken for something that's just decorative, although I don't know. I think if somebody looks at that, they're going to say, what is this, and turn it over and see the QR code on the back. You can see the QR code on those Dynatags in the center. So anyway, these are excellent means for getting your pet back. And the most important issue at all is the 6-foot leash. A leash is your dog's best friend. There is no doubt in my mind that leashes save dogs' lives every day, and people don't acknowledge that fact. The only time, when we get pets in that are, I don't know how many times I have been in a situation where I'm standing over a dead dog, listening to parents or listening to the owners say, but he never goes in the road. Okay, well, I'm sorry, they go in the road. They go in the road when you're not looking. Sometimes they may go in the road just once. And I always tell people, if you got a dog that doesn't go in the road, it's simply a matter of what kind of temptation is it going to take to get him into the road. And for just about any animal, it's there. It's just a matter of where's the threshold. Poisons are one of those things that I am concerned about. When I was in Puerto Rico, when we were cruising, we ran into some guys that had their yellow Labrador with them on the boat. One day they were in town, had him on a leash. And we're walking him down through the town in downtown Salinas, which is on the south coast of Puerto Rico. They came back to the boat and told me that they were walking him along and standing and talking to somebody, and when they looked, he came out of the bushes. He had a box of rat poison over his nose. My attitude is, if you're walking your dog in any kind of unknown situation, always keep his nose in sight, because you never know where his nose is going. Is he going to go into the bushes and run into a rattlesnake? You never know. Okay. In Michigan, or in a lot of the inland areas, that's not too likely, but Canada, that sort of thing. But if you're cruising the Missouri River or the Ohio River or the Mississippi River or inland lakes in a lot of states, poisonous snakes are an issue. In Florida, they're a tremendous issue. I see so many snake bites down here, it's incredible. Motor vehicles, snakes, skunks, and porcupines. If your dog runs off chasing a porcupine, you're probably going to end up with a trip to the vet. If you had a leash on him, it's not a problem. Anything, unexpected events, a leash literally saves your dog. And don't get cocky and think that can't happen to me, because I don't know how many times like I said, I've been in an emergency situation looking at a dead dog, and it belonged to somebody who thought that couldn't happen to them. Now we're going to talk a little bit about pet entrance requirements. If you're going to cross from Canada to the U.S. or vice versa, you don't really need much. Vaccination certificate is all you need. Want to make sure that dogs and cats both need a rabies vaccination certificate, and a 3-year vaccine is okay, and it must be specified on the certificate what it is. If you've got a 3-year vaccination in your dog and it was done 2.5 years ago, get one done before you go so you don't run into any issues. It's not likely you're going to, but that way you're safe. Get it done a month or so before you're ready to leave. There's no time constraints. If you have a dog or a dog or cat that's under 3 months of age, they don't have to have a rabies vaccine. If they're not vaccinated and you're going into Canada, then you got to take them to a local vet and get it done. Bring back the paperwork, you're probably good. If you're coming from the Canada to the U.S., again, dog needs a rabies vaccination, but last thing I knew, cats was the issue in cats was not specified. 3-year vaccine's okay, and here you have a requirement that it must be done at least 30 days prior to entry. So don't get your pet vaccinated the very first time you get your dog vaccinated and expect you're going to take him into Canada uh, on the coming weekend. It's got to be done at least a month before entry. If it's a booster rabies vaccination, that should not be an issue as long as you've had it boosted before the previous one expired. That should not be an issue. Again, you must have the vaccination certificate. A health certificate is not needed for going either way, but it's good to have a health certificate from your vet. All you need is one of those simple little ones that spits out of his computer, okay, that says, he's been examined, blah, 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 you're good to go. So do the veterinary thing, get your rabies vaccination. If there's no expiration date noted and no veterinarian, no self-respecting veterinarian is going to do a rabies vaccination without putting down how long it's good for. So you shouldn't have an issue with that. But if it's not noted on the certificate, then they're going to assume that it's only been done for 1 year. If you do your own rabies vaccination, no good. Okay, rabies vaccination is a legal issue. Okay, it may be, you doing your own rabies vaccination may protect your animal adequately from rabies, but the real issue with rabies vaccination is that it is a human health issue, and therefore it is a public health issue. And that means that your rabies certificate is a legal document signed by a veterinarian who is recognized as a doctor and is authorized to do that, that is accredited to do rabies vaccinations and the certificates that go with them. And again, don't forget the paperwork, because if you don't have the paperwork, as far as anybody official is concerned, it didn't get done. And usually what they're going to do is send you to a veterinarian and have you get it done and come back and show them the paperwork. So optional stuff for your pet's best health. This is just routine stuff that you should do. Anybody who has a pet and cares about it should be doing this stuff on a regular basis. Get a physical exam, get a stool sample and a heartworm test done, get a distemper vaccination done, distemper combination, whether it's a feline distemper or a canine distemper, get it done every year or two as directed by your veterinarian. Some veterinarians are still doing them every year. Some veterinarians are now doing them every 2 or every 3 years. Follow your veterinarian's instructions. Additional recommendations: Lyme disease and lepto. Lepto usually gets skipped in dogs that have a tendency to have vaccine reaction problems or are sensitive. Lepto is the one vaccine that is most likely to stimulate a vaccine reaction. So if in doubt, leave it out. Don't do these the day before you're leaving, so if you have a problem, you can take care of it before you go. But Lyme and lepto are options. You can get the heartworm test done. Should be done once a year up where you in most parts of the country. It also can include Lyme, Ehrlichia, and anaplasmosis, which are tick-borne diseases. So in addition to testing for heartworm, you can test for those 3 diseases to see if everything is okay in that department. And if you have a cat, get a leukemia vaccination done. It's not a bad idea. And if the cat's never been tested before, get a leukemia FIV test done. So those are some recommendations. If you have an older pet, I always tell people, consider getting a complete diagnostic health workup. Okay, blood workup, CBC, blood chemistry. Check and see if he's healthy. Check and see if there's going to be anything here that's waiting in the wings. You don't have to do this every time you're going to go for a cruise, but once every year or two, when your pet gets more than about 5-6 years old, or in case of long-lived pets, up around 8 to 10 years of age is a good time to start. But get a diagnostic workup done periodically to find out if there's an underlying kidney problem that's going to sneak up on you. Is there a liver problem that you need to worry about? Is there a problem with anemia that you're totally unaware of? There are a number of issues that can be turned up on a diagnostic health workup, and for a couple $100, if you can spring for that much, it is worthwhile to do once in a while. And as they get older, the more important it becomes. And then the microchip implant, I always tell people the microchip number is your pet's, the equivalent of your pet's vessel ID or your state ID number on your boat. This is what links your pet to his paperwork. So you prefer the ISO standard, which is the international type of microchip. And most of them are now. It used to be we had some issues 10 years ago with what type of microchip, but most of the time most of the way we have come around as far as the United States goes, and we have gotten in step with the rest of the world so that we no longer have microchips running around here that are not readable by the normal microchip scanners around the world. Most of the world is now at 134 kilohertz. There are still some 125s that are still around. Most of the scanners will, I think now will pick up either one, so it's less an issue than it used to be, but I used to spend an inordinate amount of time discussing microchips with people. And keep in mind that it is what identifies your pet as yours and says this is the pet that's on the paperwork. And it could, there's always the possibility that it could help you get your pet back if he gets lost. It's always been touted for being a way to get your pet back. I don't think it's that good for that particular purpose, but it certainly could help. These are a picture of the health certificates. The one on the right is one that's kicked out of an individual veterinarian's computer. For most circumstances, that works well, and it's excellent for going back and forth between Canada and the U.S. Certainly, it'll do you for going back and forth to Mexico if you're going to do that. The one on the left is the United States Department of Agriculture health certificate. Much more involved. Requires, it's about a 5 or 6 piece carbonless set that requires that it all be handwritten. Veterinarians don't like it. It's a pain in the butt. It has to be then sent. Once they sign it, it has to go off to your state capital and be countersigned by the state veterinarian. So there's a lot on that, and you really don't need that elaborate a document when you're going into Canada or Mexico. Just a routine certificate of vaccination. This is a microchip certificate, just basically shows that the microchip number goes to that pet. Nothing official about it whatsoever. So keep an extra copy, keep a copy of your rabies certificate in case you hand it to somebody and don't get it back. Keep it with your ship's papers, and if you have passports, keep it with those. Okay, now there are some exceptions. Pit bulls are illegal and not allowed into a lot of places. Okay, Ontario being one of them if you're cruising the Great Lakes. Depends on the country, but pit bulls are not welcome in a lot of places. And any animal that looks like a pit bull very often is going to be looked upon by the official involved as being a pit bull. Okay, regardless of whether you tell them that it's an American bulldog or a Presa Canario or a whatever else, they're all essentially the same breed. Okay, an American bulldog is essentially a Staffordshire Terrier. They are all pit bulls by essentially falling into that class. Rottweilers may fall into that class also. If you're cruising Lake Superior, no pets of any kind are allowed in Isle Royale. They don't want them anywhere around the island. They do not want the wildlife there developing any kind of familiarity with the pets. Okay, you're not even allowed to go ashore and leave your boat anchored with a pet aboard. So, no pets of any kind are allowed ashore on the Manitou Islands in Lake Michigan. So, you can anchor there, I think, with them aboard, but you're not allowed to take them ashore. All right, so a little bit on local and regional dangers. Let's talk about, you can see some issues here. We got coyotes, we got hawks, we got snakes, we got porcupines, we got skunks, we got owls. I mean, there's a lot of possibilities here that we need to be aware of. We don't need to worry about these. Skunks, all right, they're generally nocturnal. All right, if you're out at night, you may run into an issue. Now, in some of these places where there's garbage around all the time, skunks and raccoons that are normally nocturnal will kind of lose that issue and become more dependent upon when there's going to be food available. All right, they'll come out in full daylight, don't care. If they feel that there's the odds are better that they're going to find food at that particular time of day, they'll be coming around. If your dog has, so keep your dog on a leash. You don't have to worry about this. Keep your cat aboard your boat. You won't have to worry about this. In the event of an encounter, you can use tomato juice. You can use skunk off. Work it thoroughly into the coat. Let it sit. All right. Give it some time to work, whether it's skunk off or tomato juice. Rinse and bathe Okay, bathe them thoroughly, and then repeat it if necessary. And I have heard from people who have had encounters who have used both tomato juice and skunk off. It's 6 of one, half dozen the other. Most of the time, it will leave something of a potent to mild fragrance, but it will take away that overwhelming skunk stench. If the eyes have been hit, use your irrigating solution to flush out the eyes because the stuff is irritating to the eyes. Here's a homemade skunk potion that you can use. Just stuff that you may have on board. It's a good idea to have on board. A quart of hydrogen peroxide is stuff you buy at the drugstore. Half a cup of baking soda, which is a lot of baking soda. Mix it in. It's going to make a lot of fizzies when you do this and when you mix those two together. And a tablespoon of mild dish soap. And then just pour it on, work it into the coat thoroughly. Wear gloves when you do this so you don't stink like a skunk when you're all done. Then rinse with clear fresh water. Don't get it on clothing or furnishings because hydrogen peroxide, especially in the presence of the bicarb, may bleach some things. So, just try to keep it off other things. And then repeat. Do it one more time. That will usually do the trick. Porcupines also are nocturnal. Again, use a leash. Keep your animal away from these guys. It doesn't take much of an encounter to pick up a few quills. It takes quite an encounter to pick up the quills that are in this picture. But, that's the exception rather than the rule. Most of the time when I do porcupines, there'll be half a dozen in the nose, there'll be a couple in the tongue, a couple in the roof of the mouth, a few stuck between the teeth, maybe 3 or 4 in a paw. Dogs are stupid when it comes to porcupines. They'll bark their butts off, which spooks the porcupine and puts him in defensive mode. They'll then go running up to the dog, to the pork, and whack it with their foot, which really gets the dog all fired up because now he's got quills in his foot. Then they'll take their mouth and try and bite at him, usually no more than once or twice. It takes a lot of attempts. In fact, the porcupine may have ended up on the worst end of the deal with this particular encounter with this dog. But most of the time, the pork wins. If the quills penetrate the joints and the tendons, you can end up with some long-term issues. The sooner they're gotten out, the better. As they moisten up, they tend to weaken, and there's more of a tendency for them to break off in the skin when you try to pull them out. So when you try to pull them out, use one hand or an instrument. And again, if you've got more than 3 or 4, my attitude is don't try doing it yourself. If you've got a pet who tends to be snappy or screamy or whatever, don't try doing it yourself. Get them to a veterinarian. Anywhere where there are porcupines, there are veterinarians who are accustomed to removing porcupine quills. But if there's only 2 or 3 that you want to pull out, use one hand or an instrument and hold the skin down, because when you pull the quill, it's going to pull the skin away from the underlying tissue, and it hurts like a son of a gun. So use one hand or an instrument to hold down the skin, and use the other hand to grasp the quill near the skin with pliers or whatever you're going to grab it with, something that's going to hold on really well. And you can pull, there's 2 ways to do this. Pull slow and steady, or you can pull quick and hard. All right. Some feel that it's a lot less painful when you pull quick and hard. I feel like you're more likely to leave a piece in there if you pull quick and hard. But if you've got the kind of pet that's going to let you do this, you may have your choice of doing it either way. Cover the dog's eyes with something so they can't see you coming when you're doing this, if you're going to try and do it with them awake. But most of the time, they're going to fight too much, and you can make this an absolutely excruciating experience for your pet, or you can make it as unexcruciating as possible by taking him to the vet and having him sedated to have this done. And my attitude is, don't let the vet be macho about it and try to cut corners and save you money. My attitude is, if you have a reasonably young, healthy pet, and you know he doesn't have any health issues, have him sedated. It'll make the next visit to the veterinarian down the road much more pleasant for you and the pet. If it's a wrestling match and a screaming contest with somebody trying to pull quills out of your dog, the next time you need to take him to a vet, you may not be able to get him out of the car, let alone through the door. Afterwards, watch for infection. This might be a situation where you might want to use some of your amoxicillin for a few days. Most of the time, they recover pretty uneventfully, but again, keep in mind that joints and tendons and that sort of thing may be an issue. And always look the animal over thoroughly when you're, encourage the veterinarian to look him over thoroughly before waking him up. Sometimes there'll be one stuck up inside the nostril that might be missed. Okay, there might be one stuck in an ear that might be missed, or between the toes. And once he's awake again, you're going to have just as much trouble getting it out then. So try to be sure you got as many of them as possible. I find that the most likely place where for them to break off when we're removing porcupine quills is when they're in the mouth, in the oral cavity, between the teeth, that sort of situation. Okay, raccoons, foxes, and other wild critters. If it's sick enough for you to catch it, it's sick. So my attitude is don't go near these guys. You got a dog or a cat. There are a lot of dog and cat diseases that are transmissible among these particular wild animals. You don't want to take something back to your pet. You don't want your pet to pick up something from one of these animals. So keep your pet away from them. You stay away from them. Don't go, oh, the poor little raccoon. I'm going to take him to the veterinarian and see if we can cure him. So I'm going to throw him in Max's kennel and take him in to the veterinarian, or I'm going to hold him in my lap and contaminate my clothes. Don't go there, okay? You are inviting disaster. You may end up with a terminal disease of some sort being transmitted to your pet. Don't do it. Mange, distemper, a number of parasites. Just avoid the contact and turn the other way and walk away. Hawks, eagles, and owls usually are not a threat. However, if you're in a wide open space and your pet is 50 yards away from you in a meadow, and there's a hawk sitting in a tree somewhere up above you looking down, he might just swoop down and pick up your 5-pound pocket poodle. All right. So do not get stupid with these kinds of situations. Owls usually are at dusk, somewhere around dusk or in the early morning, but usually at dusk. If you have a small dog or a small cat or a kitten or a puppy, don't invite this kind of disaster because it's silly for it to even happen. Snakes are usually not an issue in most places. Now, around the Great Lakes I'm talking about here. Now, if you live in snake country where poisonous snakes are an issue, my recommendation is keep your pet on a leash, stay on walkways. A lot of times, especially in spring and fall, when temperatures are cooler, there's a tendency for snakes to lie in warm places, warm sunny places, and warm up. They can inflict a dangerous bite if it's a poisonous snake. On the Great Lakes, the timber rattler and the eastern Mississauga are endangered, so it's not likely you're going to run into them, even up on the Canadian shoreline. They are less dangerous than a lot of other pit vipers, but as far as I'm concerned, a poisonous snake bite is a poisonous snake bite, and you do not want to expose your pet to that sort of situation, because in a lot of parts of the country, you're going to have a hard time finding a veterinarian who has anti-venom available. So just play it safe. Stay on walkways and paths. Assume any snake is dangerous, even though most of the time they're not. And don't kill it. Just go around it. Even if you can hear it rattle and you can see that it's a rattlesnake and all of that sort of thing, just leave it alone. All right? You're in his country. He's not in your living room. You're in his. But remember, you keep your pet away from them. Snakes are more dangerous if they're antagonized. So if you got a dog that runs up and stands there and barks for 30 seconds before he sticks his head in to bite the snake, he's more likely to get a serious dose of venom when he gets bit. This applies to virtually any snake you're talking about. If you happen to be in cottonmouth country, be careful along anywhere near water. Because cottonmouths do have a tendency to be more aggressive than other snakes, and their natural tendency, any snake's natural tendency, is to run away when they sense danger. And animals and dogs and cats mean danger to snakes. But if it's a water snake, it's going to have a tendency to want to get to water. And if you are between the snake and the water, he may come right at you rather than going around you. So keep those kinds of things in mind. This is a picture of a Mississauga rattlesnake. They're not very big, 2 to 3 feet long. The most common snake we get down here in Florida is the pygmy rattlesnake, which is considerably smaller than this guy. Pygmy rattlesnakes are usually only a foot or two at the most and not very big around. In the unusual event of a rattlesnake bite or a poisonous snake bite, a dose of Benadryl is not a bad idea. If you can give, if you've got a 75-pound dog, give him 50 milligrams of Benadryl and get him to a vet. Um, some vets don't, a lot of vets do not carry anti-venom, and therefore they don't have much choice but to treat them with antihistamines and maybe steroids and fluids and that sort of thing. But if you are sure your pet's been bitten by a uh, poisonous snake, and usually the earmark of that is a couple of holes that may show a little bit of bloodiness to them, but a lot of swelling. Usually around the face is the most common area, but the things will swell up to the size of a softball or bigger, depending on the size of the pet. Do keep that in mind, and the sooner you institute anti-venom treatment, the better their chances are. Rat poison may be present in marinas and parks and places where there might be a public health problem from the local vermin. A lot of times down in the islands, you'd see it hidden under bushes, behind garbage bins, that sort of thing. Rat poison is becoming more dangerous to pets because it is changing. It used to be fairly simple matter when we got an animal in to give it a dose of antidote. If it was a warfarin-based, an anticoagulant type of rodenticide. Very responsive to vitamin K injections and then oral vitamin K. It was a pretty simple matter. We'd induce vomiting, give them some activated charcoal and a shot of vitamin K, and send them home with some oral vitamin K for a couple weeks. And pretty straightforward. Usually respond very readily with no after effects. Now the poisons the government is forcing the poison companies to go away from the anticoagulant rodenticides toward some other rodenticides that are safer for wildlife, but unfortunately much more dangerous to people and pets because there is no antidote for them. So it's important. Time is of the essence. If you think your pet's gotten hold of some rat poison, get them in so that we can induce vomiting as quickly as possible. If you can't get them in someplace within a matter of a few hours, try some, preferably within a matter of a couple of hours. Give them some hydrogen peroxide. See if you can get them to bring it up if you think they might have gotten some. The stuff is usually brightly colored so you can recognize it when they vomit. If you are certain that he got some, take the container with you and get to a veterinarian immediately. And again, if you give hydrogen peroxide, it's about a tablespoon per 20 pounds orally. Can repeat it a second time if it doesn't work. There is a tendency sometimes, it's not common, but there is a tendency sometimes for hydrogen peroxide to cause stomach injury, ulcers, that sort of thing, bleeding in the stomach. There's a little bit of a trade-off here, but if you're sure you got something poisonous, get it done, do it. If you can get that stuff out of his system, you're much more likely to recover. Hypothermia is an issue on the Great Lakes. If you have a pet that likes to swim in the water, keep in mind that Lake Superior in the warmest time of the year, Lake Superior is in the 60s. All right, that with prolonged exposure, even for a heavy coated dog, can lead to some hypothermia issues. If you've got a small dog that wants to swim in the water, even Lake Huron's only in the low 70s. These are not warm temperatures. This is not the Caribbean. So if an animal, particularly small animals, swimming in those kind of water temperatures, it doesn't take very long to bring their temperature down into the subnormal range. This is one reason, if you have a pet that likes to swim, this is one justification for carrying a thermometer in your health kit, okay, in your first aid kit, so that you can do a rectal temperature on your pet and find out what it is, because they will sometimes get down in the vicinity of the mid 90s down to about to 90 degrees sometimes, and once they get too cold, they lose the ability to shake, lose the ability to shiver and bring their temperature back up. So these kinds of temperatures won't even register on a mercury thermometer, and I think they're pretty hard to find anymore. So but with an electronic thermometer, it is pretty easy to check temperatures down in the mid 90s. Keep them warm. Shivering is a good sign. Shivering means they're bringing their body temperature back up. It's when they're not shivering that we get concerned. So, body heat works well. Dry them off, dry them thoroughly, snuggle up with them, get some blankets on them, an electric blanket or heating pad set on low, okay, with something between the pet and the heating. Okay, whenever you're using an electrical heating source such as a blanket or a heating pad, put some towels or some sort of insulating material under the pet or over the pet between it and the heating source so that you don't get burns, especially if they're wet. Wet patients will burn. Only do this if the patient is thoroughly dry or you're going to end up with burned skin. You do not want the heating source in direct contact with the skin or the coat. Frostbite, it's not likely that's going to be an issue. I don't think any of you are going to be out there sailing in the wintertime, so it's not likely. But ear tips, digits, scrotum, get them out of the wind, keep them out of the wind, and don't rub any of the body parts, and warm body parts slowly in the event of suspected frostbite. Prevent self-mutilation. Animals tend to chew off parts that are frozen or frostbitten. So get professional attention as soon as you can. Hyperthermia, more likely to be a problem in these situations, especially most of the parts of the country in the summertime. Excessive exercise or being confined to an area with limited ventilation, or worse yet, a combination of those two factors, will lead to heat stroke and hyperthermia. Body temperature gets up above When the body temperature gets up above about 104, you need to take measures right away. If it gets above 105, we're in danger territory. I've had patients come in with a temperature of 109, 110, where we don't know how long it's lasted. Very often they die. It's a long, drawn-out, extended hospitalization that's involved for heat stroke. The damage that's done can be permanent damage to the kidneys. There can be a lot of factors that come into play. Permanent brain damage is the thing we fear the most. Once you've started to cool them down, whether you're using cold water or whatever the case may be, if you're on the Great Lakes, a swim in one of the lakes will cool them down pretty readily. But there's a lot of people who maybe are not going to be near that kind of cool water. Cool them down until you get them down to about 103, and then let them cool the rest of the way on their own. If you cool too fast or too far, you can run into problems with messing up the blood clotting ability, and you'll end up with bleeding, uncontrollable bleeding issues. So if you think there's a hyperthermia issue, if you're suspicious that this is a heat stroke situation, get your pet to the vet immediately. Time is one of the most important things. He needs aggressive IV fluids. He may need transfusions. A lot of times on the heels of hyperthermia, we'll get hemorrhagic diarrhea and hemorrhagic vomiting. And again, it can take several days to recover, and you may have a couple $1,000s into this pet trying to save its life before you know whether it's going to survive or not. Poison ivy and poison oak is not generally an issue to your pet. You want to be careful because it can be an issue to you. If your pet goes wandering around in poison ivy, there's a very good possibility that your pet could transmit it to you when you lean over and pet him, or when you give him a big hug. Dog walks through poison ivy, comes to you, you pet him, and you're exposed to the antigens on the dog's coat. That's kind of how it works. So if you suspect anything, or if you are one of those people who's very sensitive to those kinds of plants, put on gloves and give him a bath with a mild pet shampoo. Get all that stuff out of his coat, any possibility of any of that sort of thing that you might be exposed to. Look for poison ivy first. Is the best way to go. If you're going to let your pet out, if you're camping somewhere or you're walking around in a marina and you're going to take your pet ashore, look around, see if you see poison ivy. If poison ivy is an issue, then avoid letting your dog run through it. Keep him on a leash. Pretty straightforward. Toads, all toads are poisonous. All right, that's something to keep in mind. They are not all dangerously poisonous, but all toads are pretty much poisonous. It's pretty much their only protection that a toad has. I mean, if you're born a toad in this world, if you don't want to be eaten, you got to have something, because you're pretty slow, pretty sluggish, and hopping around, bouncing around on the ground tends to attract the attention of predators. So the one thing that you have that protects you if you're a toad is to taste bad. And in the Great Lakes region, toads are not generally considered to be terribly toxic. Other parts of the country, it depends. When you get down in Florida and the southern areas where you're in the subtropical area, these toads can be potentially fatal to a small dog who licks one. They have glands that are located in the skin, parotid glands that are located behind the eyes, that are big fat areas that when you squeeze them, if you pick them, if they're picked up or excited, the things will squeeze and this gooey stuff will come out, and that contains this goo tends to contain 40 or 50 pretty nasty toxins in some of these what we call bufo toads. They are cane toads or marine toads that generally live near the ocean. They are and that's what happened when I was down in the Dominican Republic when I wrote my book. Is down there the toads are extremely toxic. This small dog got hold of one, and within a matter of 5 to 10 minutes the dog was dead. They do strange things. There's digitalis. There are a bunch of cardiac glycosides that are in these things. There are neurogenic toxins that go to the brain and are hallucinogenic. All kinds of weird things that happen to an animal when they get one of these toads, and their heart rhythms go absolutely bonkers. So the first thing that you can do, there isn't time, if you think your pet's gotten hold of one of these guys, there isn't time to get to the veterinarian to have him do this. So what you have to be prepared for if there are these kind of toads around is carry a squirt bottle of water with you when you walk your dog. If your dog happens to get one, the most important thing you can do is squirt him crossways. Don't squirt down his throat. You don't want to drown him. Squirt crossways through the dog's mouth and rinse out as much of the mouth as you can. Usually the drooling will be profuse when they do this. Take your finger, swipe it around inside the gums, upper and lower, behind the teeth. Swipe away any of the gooey secretion that tends to be there, and then again rinse some more. If you have access to a hose, turn it on low and kind of run that through the dog's mouth and get as much of this stuff out of the dog's mouth as you can. So, in most parts of the country, again, toads are not going to be terribly dangerous. You may get some significant drooling, but not much more than that. And if you have an interest in cruising down to the islands, okay, this is another book that Annie and I, and my wife Annie and I wrote about our trip down to the Caribbean. If you're interested, you can pick this up through our website, CaptainDrDave.com, or I have another website called IslandHoppingToTheCaribbean.com. Either one of those websites, you can pick up this book, or you can get it on Amazon. It's got an interesting account of our travels down to the Caribbean through the Bahamas. And that is the end of section 1. If you want to email me or drop me a line through the reply box on my website, feel free to do so. I try to answer all questions. If you have anything, let me know. I'll get back to you. May not be the same day or the next day, but I'll get back with you reasonably soon. Thank you for your time. Do turn in for session number 2.